Croesawu pawb I briefio eno. Welcome everyone to tonight's briefing. Now, before we begin, I'd like to provide a brief technical introduction. We're using Microsoft Teams today. Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings. You should see a button in your settings to switch these on. And subtitles for today's meeting are available in Cymraeg and English, as well as Filipino, Polish, Ukrainian and Urdu. Teams also allows you the opportunity to raise questions. And if you've joined via Teams, on your screen you should see a tab with a question mark on it. This will normally be in the top right. Now, if you click on this, it gives you the opportunity to ask questions which we can pose to our speakers this evening. Please accept our apologies that we may not be able to answer all of the questions during today's meeting, but we do continue to update our website and our social media channels with all the latest information. And once the briefing's finished, we'll also upload the video to our Facebook and YouTube channels, as well as to our website, so that people who couldn't watch the briefing live can watch it in their own time. Today's meeting is therefore being recorded, so don't worry, this doesn't share information about you in the audience. All that it shares is the information that you see on the screen today. And as I said, that means that people who can't join us live will still be able to see and watch today's briefing. So thank you so much for joining, and we'll now begin.
Croeso pawb i'r sesiwn gyhoeddus heno. Hayley Thomas, Prif Weithredwr dros dro i'r Bwrdd Iechyd ym Powys ydw i, a ni ddiolchgar iawn i chi wedi cymryd yr amser i ddod i'r sesiwn. Welcome all, I'm Hayley Thomas, Interim Chief Executive for the Health Board. I'm very grateful you've come along to the session this evening. Today's a really special day. It is the 75th birthday of the NHS. And I'm sure you'll all want to join in celebrating this important national service, but also to join me to celebrate and thank the staff who work tirelessly in Powys, who show care, compassion and commitment day in, day out. So thank you all, diolch yn fawr. To mark this important birthday, the Powys Health Charity has supported a large number of activities and events throughout the county. And we're extremely grateful to volunteers and staff for organising a large range of different events. This has shown to us the continued participation and the support from the public, the communities we serve and our partners across the county. And you'll see some of the photographs represent some of these events that have already taken place. For example, the park run last week in Bilth was a great success, as well as the fete held on Saturday in Cynhaliwyd Hospital and the wonderful event that took place earlier today in Machynlleth. But there are a number of other events planned over the next few weeks, so please come along and join us. You'll see them advertised. An example of that is the park run on Saturday morning in Newtown. So I'm also pleased to be able to share the recent investments we've secured in across Powys. Eluned Morgan, our Minister for Health, recently officially opened the broader redevelopment. And I do appreciate the investment was long awaited in Machynlleth, and also for the patience of the staff, patients and visitors whilst the building works were being undertaken. But the model we've developed in Broadway is really important, and it shows really a join up across all of our health services, particularly the co-location of primary care, social care, third sector, and a really important service around mental health in that community as well. I'm also pleased that our birth centre in Llanidloes was also refurbished and has opened this weekend. So that was brilliant. I had a chance to go and see it on Saturday. It's a very peaceful and relaxing place, and hope we would know that more women will hopefully choose to birth in Powys after seeing those facilities. And I guess the final point around this investment is that we have to secure this money through submitting cases for investment to Welsh Government. So we're really grateful as a board to thank the Welsh Government for the funding and for helping us to support fit for purpose facilities across Powys. In terms of staff awards then, I'm really delighted to share the success of our staff, with many leading the way in Wales and across the UK. There are some examples here I want to pass on. Well done and thanks to Judith Jameson and Louise Hymers for winning an RCN Wales Award this month. Judith won for the adult nursing category in terms of an excellent vision and leadership and innovation towards outpatient care. And Louise also won the community nursing category for her exceptional work in the field of palliative care and end-of-life care. So well done to both. And obviously Raphael Baptista has won also an UK-wide Innovation and Best Practice Award from the Community Hospitals Association. His work has been really interesting. It was about developing and implementing a pharmacy intervention recording tool, which has really helped to deliver and record multidisciplinary team input into patient care. So that was really well done. And seeing the staff being recognised in Wales and UK is a credit to the dedication of the individuals, but also to the wider teams that they work within. And, you know, I'm really pleased we've got our own Powys Staff Excellence Awards that we hold on an annual basis. And that is also a great opportunity to value and celebrate excellence in practice across Powys. So that will be taking place later this year. So really pleased about that. You may be aware that we have, as a health board now, a new statutory duty around quality and candour, and it's really important that we continue and to have quality and patient voice at the heart of everything we do. We've also got responsibilities under the duty of candour to make sure that patients are informed when things go wrong. And, you know, I'm really pleased that we're making excellent progress to continue to implement our duty as a health board, and also working in partnership with the Citizens' Voice body across Wales is really important to us. We have a number of changes that affect the population of Powys, both within Powys and across the border in England and Wales. And we've been very lucky to have a very excellent working relationship with the previous Community Health Council, which was replaced by Llais from the 1st of April. And again, looking forward to continuing to work closely with Llais to ensure the public and patient voice is at the heart of what we do. So in terms of our plan, this slide tells you a little bit about our plan on a page, and we've set a plan over the next 3 years, and it's really important. It's a continuation of some of the priorities that we set to deliver on our long-term strategy, A Healthy Caring Powys. And you can see from the priorities that we've set that, you know, it's important for us to get the right balance to ensure that we focus on in-year delivery, and we do. We've got a lot of performance targets to deliver in year, but also with a strong focus and eye to the future, as we do need to ensure that we take action to promote wellness, prevent ill health, tackling inequalities, and also to offer that focus on well-being, earlier help and support. So you'll know possibly from previous briefings that the scale of the financial challenge that we face across all public sector bodies, but particularly for health boards across Wales and in the wider UK system, that there is a substantial financial challenge that we will be managing as a health board during this year and over the next few years. And you know, that's going to be tough for everybody involved, and we're continuing at the moment to work alongside our partners in Powys, as well as Welsh Government, to continue to deliver and to discuss how we move forward to deliver the financial delivery aspects within our plan. So I do see that we will need to continue to review, improve, develop and transform some of our services during the next few years. We need to do this to keep up with demand, the changing shape of the demand, and also to respond to workforce changes and changes to technology. And I really look forward to sharing at the appropriate point and working alongside yourselves, public stakeholders and others, the people that we serve in Powys, to help shape changes and to help look at what that future model should look like for the future. So I'd like to hand over Adrian now. My voice is leaving me, Adrian, to cover the next couple of slides, please. Adrian Osborne is our Assistant Director of Communications and Engagement. Thanks, Adrian.
Thank you, Hayley, and I'm happy to help give your voice a little bit of a rest there. So within these briefings, we try and provide an opportunity as well to let you have an opportunity to shape the future of the health services that we and other organisations provide for you. And we know from previous briefings and from our inboxes and post boxes over the last year that an area of keen interest has been the future shape of air ambulance services. So thank you to all of those of you who've been involved in the phase 1 engagement on air ambulance that recently finished. This has been coordinated by a national body called the Emergency Ambulance Services Committee, and they've been out and about in communities across Wales to help provide an opportunity to explain what the service does and to hear views about what matters to you. And they're now in a period where they are analysing all of that information in order to come back to all of us later this year with some options for the future. And they'll be sharing those options with us and seeking views, and that will help make a decision about the future shape both of air ambulance services and also of the emergency medical retrieval and transport service that is part of the NHS, and that's the specialist staff that work on those air ambulances across the whole of Wales. And we know it's been a sensitive subject for people. We really know that everybody places such value on their ambulance services. So that's why we're so glad that so many people have got involved and made their views known, and would really encourage you to continue to do that in that next phase of the work this autumn. We've also got a joint survey underway at the moment across public sector bodies in Mid and West Wales to find out your views about equality. You may be aware that public sector bodies have a statutory duty to put in place an equality plan, a strategic equality plan. So this is a joint survey that we've developed with the bodies that cover the Mid and West Wales region. That's ourselves and Hywel Dda University Health Board, Dyfed Powys Police, for instance, Mid and West Wales Fire. And so those findings from that public survey will help us collectively decide how we can improve equality and reduce inequalities in the way that we provide services. So again, we'd really encourage you to come forward and share your views in that survey that closes on the 30th of July, so that we can put your views at the heart of how we make plans to reduce inequalities within public services. And in our last briefing earlier this year, we talked about the engagement that was underway in relation to an application we'd received from Cynhaliwyd Group Practice to close their branch surgery in Gylwen. So many of you took the time to take part in that, and following that engagement, the board met at the end of May and did make the difficult decision to accept that application. And that was on the basis that no viable alternatives to accepting the application to close the practice had been identified. Now, it was really clear during that engagement that a lot of strong feelings were expressed and a lot of feedback was shared about the potential impact of closing that branch surgery in Gylwen. So now we are working really closely together with the Nair and Bevan University Health Board and with other partners to put in place and implement and deliver a plan to address those important issues that were raised by you during that engagement. And we're committed to keep you posted on that work. So thanks again for everybody who took their time to share their views. We know this was a difficult decision, and we know that it won't be one that's positively received within the area, but we are committed to working to address some of those real issues that you did raise as part of that engagement. Now, we're clearly in the summer. We've seen some very, very hot weather recently as well. And so part of our job is around public health and protecting your future health. So summer safety is a big focus for us this month, and a big focus for our partner organisations like Public Health Wales. One of our top messages, as always, is staying safe from viral illnesses. We've all been living with the impact from the pandemic period, and common viruses like COVID-19 are still here. They can affect the most vulnerable people, including friends and family members with long-term conditions. So we can all take action to stay safe from those viral illnesses. It's really important to keep doing those things like washing our hands regularly with soap and water. Keeping your hands clean, honestly, is one of the best ways to prevent the spread of infections. Do also check that you and your family are up to date with your vaccinations. And whilst the spring vaccination programme for COVID has been coming to an end, we're already starting to make arrangements for what we expect to be an autumn programme of COVID vaccination, and flu vaccination will be an important part of that as well. Staying safe on holiday is the second key area that's important for all of us. Please pack sun cream. Again, that's one of the most important steps we can all take to protect our health on holiday. But insect repellent and making sure that you've packed your medications that you need for holiday are really important too. Again, check that you're up to date with the vaccinations that you may need for the country that you're travelling to, and check the latest travel advice for your holiday destination. If you're camping, for instance, or in a caravan, a carbon monoxide alarm can be really helpful, because carbon monoxide, it's a colourless and odourless gas, and it is poisonous. So an alarm can save your life by alerting you if there are dangerous carbon monoxide levels in the air near you. It's produced when fuels such as coal and gas and oil don't burn correctly. So if you're in an area, for instance, that's got low ventilation, using a boiler, cooker, gas fire, camping stove, open fire or barbecue. There's lots of useful information on our website about top tips for staying safe. We've seen hot weather recently as well. So again, high factor sunscreen, a hat, loose fitting long sleeve clothes are really important. Staying hydrated too, drinking lots of water, wearing sunglasses with UV protection to keep your eyes safe. And if you can, spending time in shade in those hottest parts of the day between 11 and 3 p.m. We're all enjoying summer barbecues at the moment as well, so eating safely is really critical. Wash your hands before and after cooking, checking your food is cooked all the way through, and if you're barbecuing, a food thermometer can help. Keep your raw meat away from food that's ready to eat, and cover your cooked food and chill it as well within 1 to 2 hours of eating, so that you don't come back to food that might be starting to be developing bacteria or other difficulties that might affect your health. And staying safe while swimming as well. Sadly, people do lose their lives, for instance, when jumping into reservoirs and pools. So check that where you want to swim is safe. Check for any warning signs. Think about safe places to swim, and if there is a lifeguard on duty, and stay out of the water if you've been drinking alcohol or taking drugs. So do check our website. There's a web address at the bottom of that page as well for Public Health Wales with all that latest summer safety advice. So thank you very much for those listening to those updates here on summer safety. I think now this is the part of the presentation as well where we moved to questions. So thank you for those of you who've been posing questions today, either through our Q&A or through our social media and email channels in advance of today. So my first question here for Hayley is, you've not long taken over as interim CEO. How are you finding that role, and what are your big priorities as interim CEO in Powys Teaching Health Board?
Yes, Mynffyn started at the beginning of May. Well, I've worked in Powys a number of years, so thankfully, I didn't have to get to know the organisation and key partners. So I think it's been an absolute privilege to be able to have the opportunity to lead this health board during this time. People have said to me beforehand that it would be a lonely job. It hasn't felt lonely. I feel I'm very lucky to work with a very unified, clear board, and also the organisation, the people, the staff that I've spoken to, hugely supportive and very much focused. We've got a strong strategy as an organisation, so really very focused on delivery. I think in terms of priorities, I probably will mention too many, but I want to mention a couple. So our relationship and working in partnership is really important with the third sector, with other partners and the local authority, and in particular with social care. So there's a strong focus at the moment, both at a policy level, at a national level, but also locally, on how we build further community care services and capacity to ensure that we can deliver appropriate care that offer around primary and community services. So I'm not just talking about GPs, but dentistry, community pharmacies, optometry, and the broad range of services we provide in the community. That is the foundation of the health service, and how we continue to support and sustain and deliver quality services in Powys is important. I wanted to mention a couple of areas. I think that yes, there's a very strong focus at the moment around planned care. As a provider, we do relatively well around the waiting times as a provider, but for our population, working with our other providers in England and Wales to deal with improvements around waiting times for people for treatment, as well as that strong focus on mental health, and I mean all ages, so children and young people and adults, and how we continue to deliver access to mental health. There's been a substantial impact of the pandemic generally on all health services, but particularly the demand that's coming through is you know, quite complex, and you know, it's important that we continue to deliver that. I just wanted to mention two things. I can't not mention the money. You know, there is a very challenging financial context that we're delivering. We're currently with a deficit plan and have a very clear plan, but you know, a strong focus on delivering the plan and the savings that we've got this year, and that's really important as an accountable officer, that we're able to demonstrate that value for money. And the final is the workforce. The workforce have had a tough time during the pandemic. Their well-being is really important. We've just shared earlier some early findings we've done around locally with the system around staff wellbeing survey. So, you know, a really strong focus on recruitment and how we retain staff and keep people well in work as well. So, you know, ultimately that's the most important thing at the moment, because when our staff are well, they're in a much better position to provide excellent patient care. So I hope that's a bit of a summary, Adrian.
Thanks, Hayley. And I think some of those issues as well are keenly felt by me today, because I'm actually sitting here in Ysbyty Bro-Dyfi this afternoon, where firstly I'm experiencing firsthand those new facilities that you spoke about in your presentation, and there's the new dental clinic just down the corridor from where I'm sitting, and new therapy and community facilities. And I was also able to join with staff today in their NHS 75 celebrations. So it was lovely to experience that firsthand. Such amazing thanks to Aled Fletcher, to the whole team here for putting on such a lovely event with so many members of the community here. And thank you to the choir from Ysgol Glantuman and from Ysgol Bro-Hydgan as well, who gave us such lovely entertainment. And you talked about staff well-being, and that community connection, that real sense of joy came across as part of those celebrations today. So with that in mind, next question really is, what have you enjoyed most yourselves about the NHS 75 commemorations so far? And there's two parts to this question. So what have you most enjoyed, but also what do you see as the big challenges facing the NHS as we look forward to the next 25 years?
Gosh, these questions aren't easy. Oh, right. So what I've enjoyed the most is just having an opportunity to just have that social contact with staff to celebrate and the wider community. For example, I was in Newtown last week unveiling amazing work. The Knit and Natter group had spent hours and hours and hours and hours of work creating this wonderful knitted topper, which is like a piece of art. So it's been an absolute pleasure to meet people, and you know, the support that I feel and that I've experienced in meeting people there at Llywodraeth and in other areas is that it's been brilliant. So it's that connecting with the local community and staff has been wonderful, and also hearing stories, Adrian. You know, people have shared their experiences of the NHS over the years and how it's changed. And I think that, you know, we are in a bit of a, you asked me about the future. I am absolutely 100% sure that we will continue to have National Health Service. So we will all be here. I might not still be working at that point, but we will all be able to rely, I feel, on a National Health Service as a society. It is absolutely essential. That principle of free at the point of care is something that is so precious, but it's not going to look the same. If you think about what healthcare looked like 25 years ago, 50 years ago, 75 years ago, and I have, you know, truth of the matter is I can think about what the next 5 to 10 years, but in terms of the technological advancement and the potential opportunities in 25 years' time, it's very hard to really get a feel of what it will look like. But what I will know is that patients will be at the heart of it. Staff will continue to want to work in the NHS. I'm convinced of that, because it is absolutely an institution and it's unique to the UK. And I think we'll all, protect it, whether we're members of the community or staff members.
Thanks, Hayley. And I think, again, that issue about us all coming together across all partners, community, patient service users, third sector, business sector, local authority is going to be so key, isn't it, to the next 25 years. I made a bit of a slip of the tongue earlier in the meeting, so I referred to it as NHS 50 rather than NHS 75, which was definitely showing my age, because I was involved in planning and delivery of the NHS 50th birthday celebrations. But it's that keen reminder of how much things have changed in those last 25 years and how they will, and how much back then in 1998 could we have predicted about how we would be working now. If I think even just how my career has changed in the time I was working, we were reflecting back on some of the jobs I used to do in the early days of comms, which included those handwritten overhead projector acetate slides, and now we're managing multimedia channels and doing live briefings via Microsoft Teams, and adding that to broadcast through our social media channels as well. It's a big change. Thinking about where we are now and what the future might hold, though, clearly this has been a big week for the Welsh NHS, for Welsh Public Service, because some of the Welsh Health Chiefs have been giving evidence to the COVID inquiry this week. So thinking about that, you had a key role yourself. You were lead director for COVID vaccination in Powys. So what did you see as actually the big learning for us from that vaccination programme? Because I know a lot changed, and it was a lot of thinking on our feet and changing at the time.
Yes, yeah. So, you know, the work on the public inquiry, but also alongside that, the Senedd will be setting up a special committee on areas of learning in Wales as well. Is that it is important for us to reflect and to identify lessons learned. And as a health board, we did do that at key points during the pandemic, but in particular, the standout issues for me was there's nothing quite like an emergency to pull everybody together. So I think that, so what I mean is that the way in which everyone responded, so our staff, their resilience, their willingness to do different things, different roles, to focus on different areas, but also the local authority in particular, how they stepped up alongside with us together. The third sector, the volunteers and the public themselves, we had a common purpose. We were responding to the biggest public health emergency ever, and that common purpose meant that, you know, everybody just pulled out all their stops to, you know, that discretionary effort, that going the extra mile. We all demonstrate immense flexibility, and we worked outside our normal roles as well. So what I mean by that is we pull teams together with particular skill sets to get things done. And some people had never worked together before, and yet got it done and really well. And there was a really strong team spirit. I think in Powys, the rurality, I was worried about it being a major factor for us. But actually, in the context of a COVID pandemic, living in rural areas was probably a benefit. But in terms of vaccination, you know, it wasn't a barrier. And that was partly, you know, the way, and Adrian, you led a very key role as well as programme director in achieving some of the highest vaccination rates in the UK. I think it was the public's response that helped us to do that as well, in willingness to come to be vaccinated to start with. And actually, I remember meeting a couple of characters the first week that I led the programme, and it was their first trip out to go and get a vaccination. It was a very emotional few days, really, to see that this was the first time some people had travelled out or left their homes during that time to receive their vaccination. But I think the key learning for me, and two standout issues, the digital changes that were put in place during the pandemic, we fast-tracked a lot. And also things like the way in which the digital healthcare in Wales helped us to develop a national immunisation recording system. It's really important from a public health point of view to know who's been vaccinated and how. And also, because of the workforce challenges that we had, we brought in a different role to vaccinate, which is not the traditional approach around using training non-registrants to actually vaccinate. And I think some of the changes we put in place, we mustn't lose. We must think about what does that mean for the future delivery now that we successfully did that in this context, because I think that there are certainly new roles and new ways of working that we should build on and learn from and build into our approach going forward. Sorry, I'm talking too much, Adrian. I'll stop.
Not at all. And I must admit, just even taking me back into those very early days of the vaccination programme actually just made me a bit emotional there. Yeah. Those very people who, some people arriving dressed up to their nines because it had been the first time out. The lovely lady who, when we asked her, is there anything that we could do to improve the way that we deliver the vaccination programme, particularly the 15-minute wait, just turned around and asked if she could possibly have a glass of champagne. So we saw all sorts of experiences through that, and I think it's really important during this time, as we're trying to continue to come out of the pandemic but know that there are some challenges still to come, is what were those key things that made partnership work during that time? What were the strengths and the assets that we drew on, because they're going to be so critical for the future? I think I've got somebody knocking on my door asking me to be able to leave the session now, so I'll just let them know I'm in a live public briefing right now. But I think that's the end of our questions right now, so very happy to draw today's session to a close. And Hayley, just over to you for any final comments that you'd like to make.
Not much other than to say a big thank you to all the staff, volunteers, and to the wider public for your support to the NHS. We're very grateful for it in Powys, so thank you very much. Diolch yn fawr.
Thank you and good night.